One of the most common questions that people new to lifting have is, how do I know how much weight to use for each exercise? Unfortunately, because of so much underdosing going on in both fitness and rehab, many fitness trainers and physical therapists need to know how to answer this question too. Too often, a trainer or therapist will ask their client or patient after a set is completed, "Was that challenging enough?" Asking this question is fine for the first couple sessions because it allows the exerciser to determine their own baseline and helps to establish trust between them and their coach. The problem with this question and approach is that it's extremely common for both novice and recreational lifters to self select weights that are too low to elicit an adaptation, which is what I mean by underdosing. Underdosing tends to be even more common in rehabilitation settings where the patient is injured, in pain, and apprehensive. Another problem with the question is that the word challenging is too ambiguous. Without context, new lifters won't accurately know what that even means. An old school way to determine initial loads was to have the person perform a one repetition maximum, the heaviest weight they can lift for only one repetition, or estimate it by having them perform a 4 or 6 rep max and use an equation to determine their 1 rep max. The problem with this is that it assumes there's no learning curve, that the person knows how to perform the movement with proper form, or more specifically, that they know how to maintain proper form under the heaviest loads they can lift, which isn't the case for new lifters, so this is the wrong approach. The right way to go about it is to purposely choose an initial weight that you know is going to be too light. In other words, you err on the side of caution. On a continuum of intuition and experience, even a novice lifter can tell after their first couple repetitions if they've chosen a weight that is way too light. For example, if just about anyone picked up a 2-pound dumbbell to perform a biceps curl, where the prescribed repetitions to complete is 10 repetitions using a weight that is challenging, they would know right away that the weight they chose is too light. But for new lifters, at some point they don't intuitively know if the weight they chose is the right weight. So begin by purposely choosing a weight that you know intuitively is too light. The prescribed repetitions should be about 10. If your intuition was right and the weight you chose was too light, after 2 or 3 repetitions, terminate the set and choose another weight that is slightly heavier. If the lifter intuitively knows that this weight is too light, repeat the process by increasing the weight in small increments until a load is chosen that no longer intuitively feels too light, and then finish out the set of 10 repetitions. Here's an example where I'm purposely choosing loads that are too light for a dumbbell chest press. As I increase the loads, hopefully you can even tell how easily I'm able to lift them, that they aren't challenging enough, and most importantly, that it doesn't take much time to find a load that is at least somewhat challenging. When you finally choose a load that feels somewhat challenging, where you completed the prescribed 10 repetitions, you have to determine if the weight was truly challenging enough to elicit some type of adaptation. For new lifters, this would equate to a perceived effort of about a 7 on a 1 to 10 scale, or in other words, a set that is right at the cusp of being a true working set as opposed to a warm-up. The way to know if the perceived effort is a 7 is if the last repetition of the set is right at that threshold where the lifter had to strain a little bit to complete the repetition. And by strain, I mean to try hard or to exert significant effort. True strain always manifests itself in the form of a look of strain on the face and the velocity of the lifting movement slowing down. So if there's no look of strain on the face and the movement didn't slow down at the end of the set, the lifter should probably increase the load a little, perform another set, and try to find the weight where some slight strain occurs. So coaches and therapists, please, after about the second session with your client or patient, stop asking them if the set felt challenging. At this point, they should be relying on your expertise and education. Explain to them the 1 to 10 rate of perceived effort scale. Along with it, explain the importance of a look of strain on the face and the velocity of movement needing to slow for it to be a true working set and to elicit adaptations. It's the professional's job to explain the information provided in this video to them so that we don't continually underdose. Once again, underdosing is fine early on. It's good to start new lifters within their comfort zone to make sure their body is responding appropriately to each session with no excessive soreness or joint pain. And we should be easing them into what it truly means for a set to be challenging. And by the way, this concept applies to all exercises in all repetition ranges. There's going to be a learning curve at first. The lifter has to go through the process of finding a load that no longer intuitively feels too light, and then use the rate of perceived effort scale to determine when it feels like about a 7. Once it gets to that point, the coach or lifter can decide when it's appropriate to increase the load for the prescribed repetitions so that it feels like an 8 or greater on that 1 to 10 scale, or in other words, that they're getting a little closer to muscle failure. But this is the answer for how much weight to choose for each exercise. A set where the last repetition caused a sincere look of strain on the lifter's face and the velocity of movement slowed despite trying to lift with the intent of velocity. It isn't a cut and dried answer. You have to take a little time to figure it out. Thanks for watching, and I'll see you in the next video.